For millions of people with chronic conditions, taking medication is just a daily reality. But what happens when that simple routine becomes a constant draining struggle? Well, today we're going to dive into a really fascinating study that asks a pretty powerful question. Can something as old as storytelling, but delivered through a modern app, actually help solve one of the biggest challenges in treating schizophrenia? All right, so first things first, we've got to wrap our heads around the scale of the problem we're talking about. For anyone managing schizophrenia, staying on medication is, without a doubt, the cornerstone of stability. It's what helps manage symptoms and prevent a relapse. But in the real world, it's just not that simple. And this number really gets to the heart of it. Studies show that about half, that's right, 1 out of every 2, outpatients with schizophrenia find it incredibly difficult to stick with their prescribed medication. That is a staggering figure, and it has really serious consequences for their health and their overall quality of life. So you have to ask, right? Why? Why is this so hard? Well, the reasons are really complex. It's not as simple as just forgetting to take a pill. It can be a whole mix of things: misconceptions about the medicine, really challenging side effects, or even a lack of insight into the illness itself, which, ironically, can be a symptom of the condition. Now, the standard way we've tried to tackle this problem is something called psychoeducation, and that's basically just teaching patients about their condition and their treatment. But think about it for a second. We're talking about pamphlets, maybe some lectures. These methods are just so passive. They're not very engaging, and that's especially true for people who might be dealing with cognitive challenges, like issues with attention or memory. So this is where the researchers behind this study decided to try something completely different. Instead of just throwing facts at patients, they wanted to immerse them in an experience. And they decided to use the oldest, most powerful form of human communication we have: a good story. The whole idea is called narrative-based psychoeducation. It's a bit of a mouthful, I know, but the concept is actually pretty simple. It's built on this principle that when we really engage with a character in a realistic, emotionally rich story, it can actually help reshape our own beliefs and attitudes. It's basically learning by doing, by feeling, but all inside a virtual world. And the tool they built to bring this idea to life is a mobile app called Healing Town. It's specifically designed to transform what can be really dry clinical information into an interactive journey that actually pulls you in. So let's take a peek under the hood. What exactly makes Healing Town so different from, say, a simple medication reminder app? Well, the app is really built on 3 core pillars. First, and this is the most important part, are the narrative storylines. Second, it's got cognitive games that are designed to let you practice real-world skills. And third, it has a practical self-management tool for tracking things like medication and daily routines. Now, here's where the design gets super clever. The user doesn't actually play as themselves. Instead, you take on the role of a friend or a supporter who's helping a character in the game navigate their recovery. You make treatment choices for that character in these realistic situations, and, crucially, you get to see the consequences of those decisions play out in the story. This creates this kind of safe distance to explore really difficult choices without any real-world risk. So the concept sounds amazing on paper, right? But the million-dollar question is, does it actually work? To find out, the researchers set up a really rigorous 6-month randomized controlled trial. Here's how they did it. They recruited 70 people with schizophrenia in Shanghai. They split them into 2 groups. Half of them, the intervention group, got access to the Healing Town app on top of their usual care. The other half, the control group, just continued with their usual care. And the whole thing lasted for 6 months. And the results were striking. When they measured medication adherence at the end, the group that used the Healing Town app scored significantly higher than the control group. And we're not talking about a tiny little bump here. The intervention had a really clear positive impact. And get this, it wasn't just about their behavior. The study also found that the app users developed much more positive attitudes and beliefs about their medication. So they weren't just taking it more often. It seems they actually understood and valued it more. I think this quote from one of the participants just says it all. It really gets to the heart of why this whole thing worked. It didn't feel like a chore. It didn't feel like a lecture. The immersive, story-based approach made the entire learning experience feel fundamentally different, more personal, and just way more engaging. Of course, no tool is ever perfect, right? When the researchers actually sat down and interviewed the users, they got some really great, honest feedback. People absolutely loved the immersive story, they praised how culturally relevant the scenarios were, and they even mentioned feeling a sense of companionship with the characters. But they also had good suggestions. Some felt the feedback tones in the app could be a bit harsh, they wanted new content to keep the story going, and they wished for more ways to personalize the experience. So let's zoom out. What does all of this mean for the bigger picture of mental health care? Well, this study is really pointing toward an exciting new direction. So if you're going to remember 3 things from all this, let it be these. First, tools like this aren't meant to replace doctors or therapists, but they can be an incredibly powerful complement to traditional care. Second, engagement is everything. Making something immersive and culturally relevant is absolutely key for motivation. And finally, for these digital tools to have a lasting impact, they have to evolve with the user through personalization and fresh, dynamic content. You know, this research opens up such a profound question. By tapping into this fundamental human need for stories, we might be able to design health tools that are not only more effective, but also more humane. It really makes you wonder, in the future, could the stories we engage with become one of our most powerful forms of medicine,